Addison, and for our GCP, we are presenting on older adults with depression.
And I'm Olivia.
I'm Sarah.
I'm Maria.
I'm Catalina.
So we decided that our cultural group was going to be older adults with depression. We chose this group to really shine light on this group that lacks awareness to further learn how to assist them in the healthcare setting. As a team, we believe that we should be an advocate for this group because it's so crucial for this vulnerable population. So in 2020, roughly around 13% of older adults have depression in the United States, and roughly around 12% of older adults have depression in Florida. So as you can see, right here and right here. Some things that make this cultural group unique is that older adults have more experience within society. They're the ones who maintain tradition and cultural values that are passed on to future generations. The elderly possess more knowledge and wisdom that we can all learn from. They play an important role and therefore have the right to live in dignity later in their life.
Many specific cultures within this group have their own specific values, but the elderly community as a whole has their own primary values that include good health routine, community, respect, exercise, comfort, financial security, and independence. Older adults value a sense of belonging, and often when they become lonely, that could lead to their depression. If the depression is left untreated, it can lead to worse adverse effects such as slow memory from physical disorders, decreased respect of self, decreased quality of life, and decreased levels of functioning. If they're left untreated, it could worsen their depressive symptoms, and common symptoms of depression include feeling worthless, anxious, hopeless, restlessness, irritability, lethargy, memory difficulties, trouble sleeping, and thoughts of or talk of suicide.
There are a lot of different treatment options for older adults with depression. The first and probably most common is medications. However, the main point of concern for older adults is that a lot of older adults are already on a lot of medications, so we have to be aware of contraindications between antidepressive meds and the meds they're already on. Cognitive behavioral therapy is another treatment option. This involves therapy and talking about feelings and effective coping strategies, and this coupled with exercise, especially low impact exercises such as like yoga, tai chi, or meditation is especially beneficial for older adults since it is lower impact and also connects like the mind and the body. The last treatment option for older adults with depression is collaborative care models. This combines a primary care physician with a mental health specialist as well as a case manager all under the same roof and practice. This has been proven to be especially beneficial since all of the treatment is under the same roof and patients can really get individualized care. It also reduces the need for repetitive screening questions since the chart and everything is under the same practice, and patients can have better individualized care and treatment, and how the adults are adhering to their treatment plans can be monitored best. All of the treatment for older adults with depression has proven to be successful. The biggest benefits have been shown when pharmacotherapy and cognitive behavioral therapy are combined. That way you are taking care of both the physiological and psychological aspects of depression. And then the collaborative care model itself has been proven to be very effective since it does provide the most individualized care on a case-by-case basis for each patient.
Depression impacts the lives of older adults in a myriad of ways, both extrinsic and intrinsic. Depression affects the activities of daily living as well as the instrumental activities of daily living. It becomes harder to do things when you're socially withdrawn or experiencing other symptoms of depression. This contributes to a positive feedback loop in which the inability to complete these things makes you even more depressed. So as you can see here, there are a myriad of intrinsic and extrinsic factors that has an impact on one's mental health and well-being. Depression is also seen a lot in conjunction with physical diseases such as higher blood pressure and other things such as alcoholism, lack of sleep, social withdrawal. And then finally, an impact that depression has on the lives of older adults is that it can impact their sense of dignity and autonomy as they depend more on others to complete tasks for them. So religion, spirituality, and culture are also things that play a role in depressive symptoms and depression in the lives of older adults. In order to avoid generalization, we have to understand that older adults is not just one culture. There are subcultures within this group that celebrate different religions, different holidays, and have different cultures. So in general, studies have shown that practicing religion leads to better health outcomes in older age because they associate poor health outcomes with somewhere to go afterwards or less anxiety surrounding poor health. In addition, another study showed that decreased worship attendance also increased depressive symptoms. So within this cultural group, there are also subfacets of religion and spirituality in which they use different ways to deal with the depressive symptoms. So in westernized cultures, depression is treated using multiple therapies such as antidepressants, psychotherapy, exercise therapy, and amongst other things. So a common health practice between older adults is primary and secondary screenings. This is most common in westernized cultures in which medicine and technology is valued. Primary and secondary screenings are used to catch and beginning to treat diseases. Additionally, the majority of older adults share the common belief that the quality of life is better than the quantity. This may deter some people from seeking care, especially if they feel as if their health is in good condition. And then finally, prayer and worship attendance amongst religious and spiritual individuals is another common health practice to help alleviate symptoms of depression.
So unfortunately, this group is faced with a lot of health disparities since older adults with depression are one of the most vulnerable groups in our society, and they face a lot of challenges in reaching a diagnosis for their depression. And then once they do reach a diagnosis, a lot of them still have trouble receiving treatment for the depressive disorder. So it was found that 3/4 of older adults are left untreated with no antidepressants, and then 1/3 of them who are medicated do not receive the appropriate treatment. And in addition to this, there are even more health disparities within the larger group of the older adults with depression based on race. So African Americans are actually less likely to receive a diagnosis of depression. That's due to multiple factors. One of them is that they have less access to private insurance, and that helps the cost of treatment. So a lot of them just have Medicare, which won't cover the entire cost of treatment. They also report of having a higher level of distrust towards healthcare providers, and this is going to cause an issue with a boundary where it's going to make it really difficult for the patient to feel comfortable having an open and honest conversation with the provider. And there's also a risk for misdiagnosis in this group since their symptoms present more somatically than they tend to do emotionally, like most providers are used to seeing. And so with the disparities that this group faces, there are certain concerns that we have which affect their health. So depression in older adults not only takes a toll on their emotional state, but also their physical state. So it really does affect their quality of life and lessens it, unfortunately. So depressed older adults tend to suffer from comorbid conditions such as heart failure, diabetes, and arthritis. And unfortunately, they do not also always receive the care which they need, specifically the quality of care that they need for these conditions. So the care that 1/4 of depressed older adult patients receive was given a service score of less than 50%, and this low score of care was associated with conditions such as osteoporosis, arthritis, and cataracts. And as a nurse, the concern of these patients would be trying to treat their physical conditions while also focusing on treating their mental well-being.
When it comes to caring for older adults with depression, it is very important to individualize care and really look at the patient in a holistic manner. It's also important to educate the patients on the importance of having regular checkups, and within these checkups doing screenings for both physical health as well as mental health. These screenings are an example of a secondary health promotion, so that way we can detect any early signs of depression or other conditions. And it is also of the utmost importance to validate patient feelings related to depression because this is such a stigmatized topic. We want to make sure that there is a good line of open communication between the nurse and the patient, and to build a good rapport. That way the older adults can feel comfortable to talk to us and express their feelings while also asking any questions. That way we can get a full and complete health history as well as what's going on at the current moment and come up with the best individualized plan of care. Thank you for taking the time to listen to our presentation on older adults with depression. We hope this shed a light on a very vulnerable group within the United States and also gave good examples of how to best care for such a vulnerable population.